And if you need an injection or something like that, if it's a cortisone injection, you can usually have it straight away. The other injections take a few weeks to organise.
Because one of the things, you visit the doctor, you have an acute pain, or whatever it is, and you're referred, you're in severe pain,
if you're in severe pain, the GPs can fax urgent referrals. And anything that comes urgent from a GP, I see my next clinic, which is why my clinics are so big, but I see them anyway. So I do a clinic every Friday morning, every Friday afternoon, when I handle one at St Albans. So I will see people at the next clinic if I get an urgent fax. The alternative, of course, is casualty route, if necessary, or sometimes it's something your GP can deal with if you're in that severe pain. But it can be difficult. I appreciate that.
You say you're not touching back?
Sorry?
You say you're not touching back?
Yeah. Physiotherapy, painkillers. You can.
I've been with my doctor for years.
Yes. With back problems, I don't really treat backs, but there are a variety of reasons why you might have back pain. But the basic treatment is physiotherapy, painkillers. It doesn't work. If you've got pain that goes down your legs, we'll get an MRI scan to see if you've got a trapped nerve. We do things called caudal epidurals, which are injections into the back to try and help the pain. If that all fails, you've had physiotherapy, then you need to see a spinal specialist. And my colleague Peter Pearson deals with all our spines. But if you've got ongoing back pain, you've had it for years, and you're not getting anywhere with your doctor, then I think it's reasonable at least once to see a specialist who may well say to you, look, I'm sorry, I can't do anything else, but I think if it's been going on for years and you're not getting anywhere despite your primary health care, their input, then I think it's reasonable to see a specialist.
After years, I sort of have practice and said to me, there's nothing I can do for you.
Yeah, no, I think you need to see a doctor rather than a chiropractor.
Yeah,
but that's a different
that
soapbox.
was the one that referred me.
Yeah.
And I said to my look, I need to see her. He said to me, and then it was too late. He said, well, it's going to be an MRI scan and I saw the specialist.
You did all that, right?
Yeah, he said, well, there's nothing I can do.
Well,
It's not so bad.
Yeah, that's.
Arthritis in the spine.
Personally
nerves.
Yeah, it's a very difficult thing to treat. We do epidurals though, which sometimes help. Yeah, I get it. It's not really my own expertise. I wouldn't like to say, but the other route is the pain management program. Sorry. Anything else?
Yeah. Can you tell me why, after the operation,
Yes.
your name is still
Swollen. It does. Yes, it is often swollen for a while, and sometimes it's always a little bit more swollen than the other one.
It's swollen for 4 years.
Yeah.
Is the other one going to be as swollen as that?
I don't know, but it's. I mean, the other one isn't as swollen as the right one.
This one
Yes.
is the one that I did for you.
Yes, and that's less swollen than your right knee, isn't it?
This one is the one.
It's bad. So it's still, but it's still more than that one, isn't it?
Which one?
That
Is
one.
This, I
Which one?
always think this is.
Really?
Yes.
Right.
And it gets stiff. Why does it get stiff?
Because it's not a normal knee. This is what I was saying. A hip is predictable, and you don't think about it. But a knee, we're getting better, and the newer designs seem to be better. But it just doesn't feel quite like a normal knee, and it can be stiff at times, and it can clonk at times. You may notice that. But you've got a good range of movement there, and it's probably better than it was before the operation.
Oh, yes.
Absolutely.
This is the one I'm suffering.
Yeah, that's what I'm saying.
In bed.
But they're never perfect, or they're never quite, as I say, like a hip. It never feels quite like you
Like
want a normal knee. Yeah,
Yes.
and I just don't think we're quite there yet.
And what I don't know, in the night, it's so painful that I
Yes.
don't know where to put.
I know.
Where to put.
Well, that's the stage where you need a knee replacement. So you're having the right operation.
So I hope that.
I think you'll find it works.
Like this.
I'm sure it'll be, if not better.
Yeah.
If not
I hope
better,
so.
I think it will.
You have really given me
Bit of
uplifted me
Good,
to go and get the
Good,
operation
good.
because I've been worried.
good. Don't be worried. You're in good hands there. All right, no problem at all.
Any more questions?
I have one. I have one for the younger generation.
Yes.
Being I'll say, reasonably active young man.
Yes,
I go running,
yes,
I play basketball,
yes,
and I play football.
yes,
And those are considered to be high impact sports in
Yes.
terms of the knees.
yes.
Now, am I going for problems in the future, or is there anything I can do to kind
It's
of
good
help
que-
me
good question.
going forward?
The human body,
Yeah.
God forgive me, is not the most brilliant design in some ways. Okay, the cartilage that you're born with, yeah, is the one you have your whole life, and when it's worn out, it's worn out. And you have a choice in life. You can either sit on a sofa and watch TV, get fat, and have reasonably comfortable knees, or you can live and play sport and do the things you want to do, and at the end of the day, be able to tell a story and have enjoyed your life. I'd go for the second option. I'm not at the moment. But yeah, if you do high impact sports, you are at risk of damaging your joints. But you know, you've got to live, you've got to enjoy things, you've got to do exercise as well, and it's a happy medium. You know, Premiership footballers will wreck their joints. They will all have arthritis and they will all have terrible knees in their 60s, no question about it. But they played for England or whatever, yeah? Yeah, and they'll be telling their grandchildren that. So you've got, you know, I think if I could have played for England, I'd rather have taken that option, if you like, and told the story at the end of it rather than thought, okay, I've got to preserve my joints, I can't, you know, I've got to wrap myself up in cotton wool my whole life. I think you've got to live. I think that's the bottom line. And then we're here to help you along the way if you run into trouble.
Are there any soft impact sports, if that makes any sense?
I mean, road running is the worst, I have to say.
Okay.
Is the one that really, if you're worried about wrecking knees, but I still wouldn't worry about it, honestly, unless you've got a problem.
No. Not yet.
I know you watch these. Exactly. Look, I know you see a talk like this, and you think, oh my God, I'm doomed. But it's not the case, okay? It depends whether it depends what you know. I said it's a 1 in 4 chance, yeah. In other words, 3 out of 4 people are absolutely fine. Okay, so I wouldn't. I wouldn't give up anything unless you run into problems, honestly. You know, there are high impact activities, but if you enjoy them, then do them.
Okay.
All right.
Thank you.
Thank you very much. Not at all. No, it's a pleasure.